Good morning, everybody, and welcome to the Stigma Rebellion. I'm streaming live into the Stigma Rebellion page this morning, and I'm going to be sharing this video, this live stream, into the Dr. Tess Crawley and Associates Facebook page as well. So if you give me a minute, I've got my laptop to my side here, and I'm going to be sharing the live stream across to the other page. So bear with me while I do that. But while I'm doing that, I can see Letitia has joined. Good morning, Letitia. Nice to have you with me. Now, if you've not seen any of my videos before, of course, I'm Dr. Tess Crawley. I'm a clinical and forensic psychologist, and I'm based in Hobart, Tasmania, but we have offices in Launceston and rural outreach around Tasmania as well. Good morning, Emily. I can see you've joined as well, and I think this was your idea for me to talk about BPD, or borderline personality disorder, today. So I am looking for my live stream in my on my laptop, so I need to find the live stream in the group, and there it is. And then I need to doesn't seem that I can share it live to okay, I've learnt a lesson this morning. I can't share live out of a closed group, so I will need to I'll need to share this later into the other group. So down the track, I'm thinking what I might need to do is live stream out of the Dr. Tess Crawley and Associates page, and then share it into the closed group so that you guys can still communicate with me live via this group. Emily's saying, hi, yes, it's an area I want to learn more about. Well, I've been thinking, Emily, that I'll do a few videos on BPD because it's a really big topic. And I've done a couple of series on other topics. So I did a little series on anxiety, and I did a little series on overcoming fear and self-doubt. So I think it's appropriate that in Borderline Personality Disorder Awareness Week I do a little series on borderline personality disorder. So this morning what I thought we could do is have a little overview of what is a personality disorder, and in particular what is borderline personality disorder. Now I think it's appropriate that I mention, this topic does also cover off on issues to do with trauma, so be mindful that there might be some triggering topics discussed when we talk about borderline personality disorder. So if that is something that applies to you, if any of you are concerned that this content might trigger you in some way, but you still want to hear it, by all means go ahead and view it. I'll be very mindful of what I'm saying, and I'll be using very non-graphic topics to describe BPD. I won't be going into details about examples, so I'll be very mindful of the capacity for triggering, so I'll be very mindful of what type of content I cover. But if it does bother you, if it does affect you in some way, by all means make sure you have some support around you. If you've got a trusted person that you can call if you need to just debrief, or even if you just need to change your track of thinking, because sometimes talking to a friend, you don't necessarily even talk about the thing that was bothering you. Sometimes just talking to a friend can be that cognitive interrupt that changes that thinking track and gets you back online, back to where you were before. So, what is a personality disorder? Now, another little caveat, I'm not going to go into grand detail about diagnostic criteria, because I don't want to be another Dr. Google that people are using to diagnose themselves or others. But I will talk about what the condition is, what it looks like, what causes it, and how we treat it. And the good news is that, once upon a time, borderline personality disorder, in fact most personality disorders, but particularly borderline and also antisocial personality disorder, were seen as the two personality disorders that were untreatable. And people with those personality disorders in the past were thought as being, basically not worth the time of mental health clinicians, which is of course a great tragedy, because it is just the opposite. Borderline personality disorder, while it is something that you'll always live with if you have a personality disorder, the symptoms, if you like, can be learnt to be managed. So you can learn a range of skills to manage the symptoms of borderline personality disorder. In fact, it responds very well to some particular types of treatment, but we will talk about that a bit later in another session, or another video I should say. So today I have my lovely assistant Miles here with me. I've been away on holidays. You might have noticed with some of my other videos, I've been away in Queensland, and poor old trainee therapy assistance dog Miles was missing the children and I so much that he got quite unwell and had to be taken to the vet in my absence, but he's made a miraculous recovery since we've gotten back. So he's not leaving my side today, but I'm sure you won't mind having him here. Okay, so what is a personality disorder? Let's start with that, shall we? So, well, what is personality, really? Personality is like a constellation of traits that make up who you are. So your temperament, you know, your mood style, if you like, whether you're an introverted type of character or an extroverted type of character, whether you are somebody who gosh, you know, there's so many personality characteristics, I'm not going to rattle them all off, but I think we understand what we're talking about. Somebody's personality is basically the makeup of who they are as a person, their personal style. Hi Tammy, I can see you've joined us too this morning. Welcome. And personality is something that is partly born with and partly molded over time. So we're born, most babies, you can tell most babies' temperaments very quickly. So most babies are born with some style of temperament that they often will carry through life. So some babies you can be, you know, are described as easy babies. You know, they're quite gentle, quite placid, quite quiet, not very demanding, and so on. Other babies might be quite sensitive babies, so they need a lot more support and a lot more interaction than you would normally give, and are very sensitive to noises and so on. So you can tell a baby's temperament quite early on as you get to know your baby, and of course those characteristics will carry through. A personality disorder is where something has interrupted the healthy development of personality. Now, that something can be a genetic thing. So some personality disorders are most commonly linked with genetic transmission, and some personality disorders are more commonly linked with environmental factors, so things that cause change in the development, in the healthy development of personality in childhood. So if we think about borderline personality disorder and antisocial personality disorder, two very different personality disorders, but both of those are linked very strongly with environmental factors in childhood that have disrupted the healthy development of personality. So, and often both associated with trauma, sadly, in childhood. So borderline personality disorder, we're typically seeing as a result of factors in a child's life that squash the child's healthy expression and exploration of emotion. So if a child is in an environment, growing up in an environment where either they're not allowed or it's not safe to openly express their emotional experiences, a child will very quickly learn to squash that down and keep that silent and keep that bottled in. Now, a child growing up in a traumatic environment, that's a safety mechanism. Okay, so for that child to keep their emotions in check is a safety thing. It kind of keeps them fairly invisible and fairly safe from their own emotional reactions to what's going on around them. So we can understand from a survival perspective how personality disorders like borderline personality disorder exist, you know, from a survival perspective, you know, through, you know, our development as a species, if you like, there's an element of logic to why you would not want to be distracted by emotions when you're in a dangerous situation. So obviously we're talking about, though, not just one single event. We're talking about constant exposure to some form of either trauma or emotional neglect, those sorts of childhood factors that lead a child to make the logical decision that it's safer for them to keep their emotions in check. So for that kid growing up, that's a really sensible thing for them to be doing in those situations. It's when they get older and when they're an adult that they then have difficulty regulating their emotions, because they've spent so long keeping their emotions squashed, that then when they become an adult, they have no skill in being able to keep their emotions in check. So borderline personality disorder is often marked by quite rapid mood swings. So people often relate to the notion of having moods that go from 0 to 100 in 60 seconds. Okay, so this notion that you can be having your normal day, and then something simple might happen. So you might get, you might see someone in the supermarket and you wave, and you think they've seen you, and you think they've ignored you. Now, whether they actually have or they haven't is kind of irrelevant. Your mood will just explode, and that person is written off. That's it. I'm never speaking to that person again. Quite an extreme reaction. It might be that that person was someone like me, got the earbuds in their ears talking to someone on the phone while they're walking through the supermarket, and I can look like I'm seeing what I'm looking at, but I'm actually really concentrating on what's going on in here. So there might have been a really innocuous explanation for what was going on, but for someone with borderline personality disorder, those wild mood swings, plus a real tendency to hold grudges and not really be able to shift from that. It's like a cut and run approach. And again, if we think about children in a traumatic environment, if somebody's breaching their trust in that environment, it's not safe for them to trust them a second time. So it's like a survival skill. Again, that makes sense while the child is in that environment, but once they're an adult, it stops making sense. It becomes a problem. So a lot of these survival strategies that these kids growing up in traumatic environments learn to develop make perfect sense while they're still in that environment. But once they're out of that environment, so they're an adult living their independent lives, those survival strategies that were a tool for them to cope with what was going on suddenly become a problem. Well, not necessarily suddenly, but they become a problem. So one of the big factors with borderline personality disorder is fear of abandonment. So this often affects relationship choices. So, people with borderline personality disorder find it hard to maintain relationships because they're often making not necessarily the most healthy choices around who's a safe bet to form a relationship with, because they haven't had a lot of exposure to what a healthy relationship looks like. On the one hand, they've not had a lot of exposure to how to form and maintain healthy relationships because they're too busy surviving their childhood. So then all of a sudden finding yourself in an adult world or a teenage world and thinking, okay, well now I'm an independent person and can make my own choice. That person seems like they like me. That must be good enough, and I'll stick with them. And of course that might not be the necessarily healthiest basis for a relationship. So a lot of people with borderline personality disorder do feel that they're often taken advantage of or manipulated by other people, which is ironic because, of course, people with BPD are often accused of being manipulators. I'll talk about that in a minute because that's a real bugbear of mine. So relationships are often affected, and because their relationship skills and their relationship, if you think of that term emotional intelligence as applying to certain sectors of your life, if you think of relationship intelligence, it's like they haven't had the opportunity to flex their relationship intelligence muscles. And again, though, a skill that can be developed over time. Borderline personality disorder is also associated with chronic suicide risk and self-harm risk. So it is a condition that we take very seriously in the mental health profession because obviously, and this is where the accusations of manipulation are often levelled, people who can't manage their emotions, they also find it very difficult to tolerate their own emotions. So often people with borderline personality disorder are trying to escape their own emotions. They can't. They find them frightening, they find them overwhelming, they don't know how to manage them, and they will often take measures to try and escape their emotions. I'm not going to talk in detail about self-harm today. I will talk about that in a separate video, and that will be plastered with trigger warnings, so you can choose whether or not you want to listen to that particular vlog separately. Okay. Getting back to manipulation though, borderline personality disorder, you know, most of the behaviours are an expression of what's going on internally for them. It's actually not typically intended to be a tool for manipulating other people, although that might be the end result. People feel manipulated, or people will do things because of self-harm. In actual fact, it's usually about trying to tolerate what's going on internally for that individual. And once you get your head around that, working with borderline personality disordered clients, as I have over many years, you can see that that is a behaviour, that is a communication tool, and that is something that, again, some skill can be built up around. Borderline personality disorder is also very stereotyped. So women are more commonly diagnosed than men. Personality disorders, our diagnostic manuals state quite clearly you cannot make a diagnosis of a personality disorder until someone is an adult, because of course they're still maturing during their teenage years. And what might look like personality disordered behaviour in teenage years may just be teenage mood swings. We do often see, though, teenagers who fit all the criteria, including the childhood experiences that we'd expect to see in someone with borderline personality disorder. And my battery is going to run out soon, so I won't talk for much longer. And we will work in the same way with those young people as if they had a diagnosis, because of course those skills are beneficial to them too. So that is a very brief overview of what borderline personality disorder is in this BPD Awareness Week. I will talk more on these topics over coming days, and like I said, when I do a vlog based around self-harm, I'll plaster that with trigger warnings so that you can avoid that topic if it's one that might trouble you in particular. Thank you all. Stats, what are the approximate stats of BPD? Not something I carry in my head, Emily, I'm sorry, but I can look that up for you, and we can talk about that next time if you're interested. I will do some research for you. We talk about the magic 1% of the population meeting criteria for most diagnoses, but I'll check whether or not BPD is the same. So have a great day, everybody. Thank you to those who are joining me live. It was really lovely to have you with me. I'll talk more about borderline personality disorder again tomorrow. And I wish you all a lovely Friday. Have a great weekend. Emily's saying that's okay. She can probably find that info. But look, I'm happy to look it up because everybody else might find it of interest too. Have a great weekend, everybody. And I'll talk to you again soon. Bye for now.